This is Scott Becker with the Becker Private Equity Podcast. We're joined today by brilliant guest Matt Wolf. Matt's going to talk to us about a lot of the discussion that's going on around private equity in healthcare and the regulatory attacks on it and the regulatory reviews on it and the perspective on that and what that means for private equity in healthcare. Matt, let me tee it up and ask you to take it away. What are you watching? What are people saying about private equity investment in healthcare and sort of the regulatory climate in DC around it?
Yeah, thanks, Scott. I mean, we're seeing an uptick in conversations, discussions, particularly at the state level, actually, around regulating private equity's involvement in healthcare providers specifically. We always kind of see this surge in election years, or often see the surge in election years, I should say. But this year the surge seems to be a little bit bigger, right? The tide is coming a little bit higher. This year, we've seen proposed legislation in California, Minnesota, other states that would essentially, especially even the Minnesota law, would basically just completely preclude a financial investor from owning any sort of any sort of healthcare delivery model, even in a way that really, at least on the surface, doesn't seem like it could be kind of structured within any sort of MSA type arrangement. And regulators are really looking and scrutinizing private equity's role in the ecosystem. And it's sort of our opinion that there is a role for private equity in healthcare, and we're curious to see how this plays out. And it's interesting. You mentioned sort of business tax of the regulatory environment, and that's absolutely true, right? I mean, whether these laws get passed or not, just the presence of them will create a tax on deal flow as sponsors evaluate opportunities across the U.S.
Absolutely. And this stuff tends to, over the years, ebb and flow. There are some states that traditionally made it very hard to own healthcare entities like New York. But as we discussed, and as you mentioned, over the years, people have developed all kinds of sort of MSA structures or workarounds similar to the corporate practice of medicine, which was intended to not allow corporate actors to own or employ physicians. Many states got rid of the corporate practice of medicine. Other states, there's been all kinds of different workarounds in that. And, there seems to be another clamor, both federally and statewide, against particularly private equity, not just corporate, but private equity financing of healthcare. And is that just a boogeyman type of thing where people are sort of pointing to private equity as the problem? Or is that, what is the reality of private equity actors, and why is it just that they're demonized, or is there a real difference in how they act that makes them worthy of being demonized? What's the sense of that?
It's a great question, right? And we've seen, going back to DC, there's been several hearings over the past few years on that exact question. And people will present data and studies that show private equity-backed practices lead to price increases or declines in care and things like that. And that data is out there. There's other data out there that does not find the same conclusions. I think there is, some of this is definitely political saber rattling. We see that across a variety of issues, whether it's private equity involvement in healthcare or industrial policy, whatever it is, right? Powell's testifying to the Senate right now as we record this, and there's a lot of saber rattling and posturing around the Fed. I think the reality, just like every other issue that we try to tackle in the political arena, is that it's much more nuanced, right? It is a fact that there are communities that have healthcare providers because of private equity investors that would not otherwise have access to that care if it weren't for those sponsors, right? And I think everybody's frustrated with rising healthcare costs. Everybody's frustrated when access to care is decreased or isn't as available as we would like it to be. But to simply blame private equity is very reductive, and I think those legislators or policymakers and others would be a better use of time to look more holistically at the problem. It's if private equity is contributing to the problem, and I think the jury's out on whether or not it is, it's certainly a small player amongst many other factors that are sort of stressing out the healthcare system and creating the issues that we all have to suffer through in terms of price and access.
Yes, no, absolutely. And obviously, there are situations where, for example, private equity may be a more excessive as a system user of debt than other types of financial partners or strategic partners, capital partners. But regulating how much debt somebody uses, because it seems like where you're getting in trouble, at least recently, you've got this whole discussion of the Steward healthcare system, low margin, high debt business, high leverage model causes trouble, ends up, hospitals going in and out of business. But certainly there's a ton of other health systems that are not for profit that have had financial troubles too. But I think it's easy to demonize private equity. Private equity now controls X percent of physicians in the country, but at the end of the day, it's a relatively small number compared to some other corporate actors and some other health system actors as well, but somehow that becomes more demonized. But a fascinating perspective. And I guess from a private equity investment perspective, do you look at this with a grain of salt and just say this is the natural periodic thing where they come after us, or how do you look at that?
Yeah, it's a great question. It does seem like there is this periodic surge of interest in how private equity is investing in healthcare providers. And that's specifically where we've seen the concern and the focus is on the actual healthcare providers. And it seemed like over the past however many years, every surge has gotten a little further, right? That tide has risen, has come in a little bit more. Is this the year? Is this the cycle where states outright ban private equity from buying practices? I don't know. That's difficult to say. I would say, if you're looking at a deal for a provider that is in one of these states that has proposed legislation on the topic, to definitely factor that into the investment decision. What I can say too is I've talked to several healthcare focused sponsors over the past few weeks, and they're shifting focus, right? They're actually they're like, yeah, we'll still do a provider deal if the one kind of comes around us, but they're almost going towards more of a pick and shovels play of let's invest more in the revenue cycle technology. Let's invest in healthcare data analytics. Let's invest in supply chain or other factors that kind of ride some of those same secular, cyclical, and macro tailwinds that healthcare providers feel, but without all of the regulatory scrutiny.
Right. And so do you think part of that is just the reality that some of these markets are harder to invest in now anyways, and some of them use this as an excuse for their investors and talking to which they were staying away from it? Or do you think that's really the driver of it? And I think it's hard to tell.
Yeah, I mean, I think that's a fair point. It's sort of this additional level of uncertainty means that you have to have greater conviction in an investment thesis for a healthcare provider now than you needed to have 5 years ago, or maybe even 2 years ago. And so if you're a sponsor that has the requisite skills, experience to build that level of conviction, then by all means continue to go forward. But I think that's a great way of thinking about it, is that if nothing else, this sort of uncertainty cost related to the regulatory environment just raises the stakes for each deal a little bit.
Yes. No, I think that's exactly right. And the margins it hurts, it may not be at all the reason that drives people away from it. Maybe a small reason too, but no, over time it can be, though. Can be absolutely fascinating. Matt, anything else you wanted to share with us on this and what you're seeing, today?
I think I would just say that at the end of the day, when we look at healthcare providers, yes, there are some very large players, but it's still a highly fragmented industry. And in many cases, still kind of a cottage industry. And there are tools and technologies and management expertise that can be brought to the provider space that can, at least on the margins, on the edges, help improve delivery, reduced cost, and there's a lot of opportunity for that. Is private equity the right vehicle or the wrong vehicle, I'm not going to say, but I do think it is a vehicle that is part of that conversation because, frankly, we just need investment in our healthcare infrastructure. It needs investment, and I think there's a role for private equity to play there.
No, 100%. Matt, I want to thank you for joining us. We could not agree with you more. This idea of demonizing private equity to me is the silliest thing ever, but it's a red herring. It's a distraction. It's the typical political thing of trying to point towards somebody and try and find a blame for something when there's so many other big problems. We just need more doctors and stuff like that. So could not agree with you more. Thank you. I agree with your sentiments. Matt, anything else you wanted to share today, or did I knock you out there?
No, I guess the one final item too is I would encourage people who are digging into and potentially on the side of demonizing private equity and healthcare providers to ask themselves and think, why are doctors selling to private equity, right? I mean, certainly there are a small number, I would say, who just want a big fat payday, but they don't even really get that anymore, right? Most private equity deals with physicians are structured such that they kind of continue their compensation, maybe get a little bit of extra equity in the business, but it's not, they don't really get that payday that I think a lot of regulators or members of Congress might think that they do. And so just ask, like, why would they sell, right? Most doctors are good people. They want to provide their communities with care. So why would they sell? What's broken with the system that they can't exist on their own, or they don't want to go work for a hospital? Just ask some different questions.
Yeah, no, I think that's a great perspective. I mean, there's just not enough doctors, and there are challenges with anybody gobbling up all the physicians and taking control of them. But it just is we need more physicians. It's simple as that, if you ask me. In any event, Matt, as always, great to visit with you. Thank you very, very much. Chanel, our producer, thank you very much as well.
Thank you.